If you were diagnosed with a terminal illness, would you want to peacefully go to sleep and not wake up, or would you want to have to suffer through every second for the rest of your life? If you had a loved one that was diagnosed with a terminal illness and all they wanted was to peacefully go to sleep and not suffer anymore, would you want to watch them suffer through every breath they take, every move they make? I'm an LPN in a nursing home, and I've worked in a nursing home for about 5 years, and I deal with a lot of death and dying, a lot of times with terminally ill patients. There isn't anything quite as heart-wrenching as watching a terminally ill patient cry in pain and suffer when all they want to do is fall asleep and go peacefully out of this world. Did you know that 70% of terminally ill patients prefer to die in their homes, but only 25% get to? We as Americans need to fight for physician-assisted suicide. We need to fight for physician-assisted suicide to promote autonomy and human rights, to end unnecessary suffering, and to educate the misinformed. Autonomy is defined as the right of self-government. This means making our own decisions, our life decisions, the decisions on what school we want to go to, what physician we want to see, what medications we want to take, what we want to have for dinner at night. Autonomy is human rights, the right to make our own choices. Religion is another right that we have. We have the right to study whatever religion we want. And in many religions, the ultimate goal is the afterlife. You live your life to get to the afterlife and what happens in the afterlife. How great would it be if a terminally ill patient could determine when it was their time to go, take a medication, and peacefully cross over to the afterlife calmly and peacefully? We as loved ones, caretakers, and fellow human beings need to assist in ending unnecessary suffering. Most terminally ill patients end life bedridden, incontinent, unable to do their daily living activities, and they depend on someone else for that, many times making them feel like a burden. We need to educate others on physician-assisted suicide and the misconceptions that go along with it. Many people say that it is a slippery slope, that there needs to be boundaries, and that the boundaries couldn't be clear, but the boundaries are clear. With the safeguards that are in place, the candidates must be diagnosed by 2 different physicians with a terminal illness with a prognosis of 6 months or less to live. They must be deemed competent by a psychiatrist, and they must be 18 years or older. If these guidelines are followed through, this is just as foolproof as any other medical decision. Another misconception is that a physician gives you a lethal injection and that's how you pass away, which is not even close to true. In physician-assisted suicide in the United States, a physician prescribes you a lethal dose of sleeping medications, mostly barbiturates. And you get this prescription and you take it home, and when you are ready, you administer it to yourself, and you just fall asleep within 10 minutes to 30 minutes, and you usually pass away within 2 to 3 hours after ingesting the medication, but you are sleeping peacefully throughout the whole process. 9 U.S. states have laws regarding physician-assisted suicide. How awesome would it be if we had 50 states that had laws regarding physician-assisted suicide? We as Americans need to educate people. We need to promote autonomy and human rights. And we need to advocate to limit the unnecessary suffering that these people have to go through. So please tell me, if you were terminally ill or watching a loved one that was terminally ill, would you want to suffer or watch them suffer? Or would you want to peacefully go to sleep and drift into the afterlife?